So, hello and welcome everyone to Good Mental Health Disorder Dialogue Series 2022. So, this is DD3, wherein I am going to talk about depression. So, this is a disorder that is very common, definitely, but we are going to talk about it in details. So, there are just 2 minutes left to start for this disorder dialogue series 2022. So till then, let others to also join and then I'll start. So it is sharp 4 and I should begin with Disorder Dialogue Series 2022. And this is an episode that is on disorder, that is depression. So I'm going to give a detailed view about what is depression. So to begin with, I would like to give my introduction. Many of you do know me, and for those who doesn't know me, I'm the founder director of Good Mental Health, an RCI rehabilitation psychologist, also a professional adoption counselor, international radio show host, life coach, and a baby podcaster. Why I said baby podcaster? Because I have recently opened up a channel, the podcast station, and that is what I am continuing here. So, all right, that's about my introduction. And to begin with Disorder Dialogue Series 2022 Depression, wherein I'm going to talk about the detailed insight about this disorder. Also, I'm sure that many of you do know the overview of what is depression, but you might doesn't know that depression has various types. And during this session, I'm going to give you the detailed information about each types, and the people who are going through depression can definitely just check out those symptoms and match with them that what kind of a what type of depression they are going through. So, when I'll be describing all of this till the end, and if any of you in the audience have any queries, you can put in the comment section below, and definitely your queries will be answered during the live telecast only. And your queries will be sorted at the end of the session. So, you need to maintain patience and stay tuned with me till the end. So now beginning with what is depression, I would like you to continue to keep, stay tuned with me so that you don't miss anything. It is going to give you a great insight. Starting with what is depression, I would like to tell you on the screen, you can see why I've opened these slides, because when I'll be explaining, there are certain things that, you can well understand when you can see on the screen. So, okay, without wasting much of the time, so depression is basically a mood disorder. So, when somebody says that somebody is experiencing depression, they are experiencing this disorder, which is mostly related to mood disorder, which is a persistent thing, and wherein the person either feel a lot of sadness or a lot of loss of interest in things that usually a person do enjoy or like in their day-to-day life. Also, it is called as major depressive disorder, or in other terms it is called as clinical depression. So depression, as I mentioned, that it is a very common common illness that is found in many people, and it is a serious illness too. Don't take depression very lightly. It can impact people very negatively. It can affect you, the way you think, the way you feel. Also, it is going to reflect on your actions as well. So you need to be sure of getting to know what exactly you're dealing with, and you should know how you need to go about it further. Also, it can lead to variety of either emotional and physical, emotional related concerns, also physical related problems. So when somebody is experiencing depression, what exactly happens is there is a chance that with depression there can be series of other symptoms that can show up in emotional health concern. Also, this can later impact the person's physical health too, and it can interfere your daily day-to-day routine life. Fortunately, the good news is that it is treatable. So if somebody is experiencing depression, there is nothing to worry. All you can do is that you can just seek out professional help. So it is treatable. Any type of depression can be treatable. So interventions are there, and you need to take a first step forward. So, moving on to the different types of depression. Now it's my time to be sharing with you the types. So, the number one which I have picked up is major depressive disorder, which is also called as MDD. So, when we talk about MDD, it is also called as clinical depression. Sometimes it is called as unipolar depression, or called as mood disorder, or simply we can say depression. It involves low mood. It involves loss of interest and pleasure in the usual activities that a person do enjoy in their life, maybe. But at that point of time, they don't seem to be happy with anything and everything. They just don't find it relevant, right? So when somebody is experiencing MDD, there are certain symptoms they can get to know if somebody is experiencing MDD. So let's check out the symptoms. So the major symptoms of MDD are depressed mood. The person remains extremely depressed. There's a lack of interest in activities normally that a person enjoy in their life. Also, there are changes in weight. Either the person will increase the weight, or lose the weight, right? And there is a change in pattern of their sleep. There's a lot of fatigue the person feel, experience that there is a feeling of guilt and worthlessness, as if the person starts to feel that I'm not worthy of anything, I'm not capable of anything. And the person definitely finds it difficult to concentrate, and the focus or the attention is very difficult for that person at that point of time when the person is depressed experiencing MDD. There's also a thought of death and suicide. So these are the symptoms of MDD. Moving on to the another type, which is persistent depressive disorder, also called as PDD. When I'm talking about persistent disorder, so it is also called as dysthymia, which refers to chronic depression which lasts for longer time. It can take up to 2 years or so on. People at a certain point of time in their life, when they are experiencing or diagnosed with PDD, maybe in between of their time, they feel that they are absolutely okay, but these symptoms are short. You can say that that is less than a 2 months, or last up to 2 months, right? But again, the person, as is its name says, that persistent. So the depression is persistent, that show up in a person persistently again and again. So these symptoms are not severe as major depressive disorder, but they are unescapable. The person cannot escape out of the symptoms, out of what the person is experiencing in their life, right? And of course, they last for a longer time. So that is how it is a problem. The next, I would like to tell you about the symptoms of PTT. When I'm talking about PTT, the symptoms are loss of interest in daily routine activities. There's a lot of sadness, lot of emptiness, feeling wherein the person tends to feel very low. There's a tiredness, lack of energy. Person really feel that they are very lethargic, and they feel that their self-esteem is being affected. They feel very low in self-esteem. They feel self-criticized. They keep on criticizing themselves for whatever, for everything. They criticize their own self as if they feel that I'm not good enough to be doing anything. There is a feeling of incapable. So completely the person feels that I am incapable of doing anything. There's definitely another symptom wherein the person find it very difficult to concentrate on things and make any decisions. It's not easy for a person experiencing persistent depressive disorder to take decisions in their life. There's a lot of irritability and anger things that are being shown in the form of symptoms in that person. And the person tend to decrease in in their productivity, in terms of their activity, in terms of effectiveness of whatever the person does in their routine life. And there's a feeling of guilt all the time, and the person keep on worries over the past. So there's a poor appetite, and sometimes in that the person tend to overeat or doesn't eat at all or doesn't feel like to eat at all, right? So, and there are sleep problems also, which are associated with PDD, which is persistent depressive disorder. Moving on to the next type, which is bipolar disorder, which is also called as maniac or manic disorder. So, bipolar is again a mood disorder, also known as maniac depression, which is a mental illness that brings severe high and severe low moods that changes the sleep pattern of the person, energy pattern, thinking, also the behavior of the person that actually is impacted. Again, I'm repeating that this is again a mood disorder wherein the symptoms are either very high in nature, extreme in nature, or either very low in nature. So people who have bipolar disorders have periods in which they feel very or overly happy, energized, joyful, and there are other periods when it happens when they are feeling very high, they are very happy, they are very energetic, they are feeling overly for everything in their life. But when there are periods of low in their life, at that point of time they start to feel very sad, very hopeless, and very sluggish, as if they have no energy to do anything. So in between of these periods, basically they usually feel normal, and it is for some time. And their moods basically that keep on changing. They never get to know when it is going to be high, when it is going to be low. And sometimes when there isn't any high or low thing in them, that's the time period they are living a neutral life, and they doesn't believe easily that what they are experiencing is a emotional health concern. So, moving on to the types of bipolar disorder, as every type which I described here in bipolar, it again has its own types. So, bipolar is one type, and bipolar two disorder, bipolar two type. Basically, there are types in bipolar one, bipolar two. Also, the other ones are cyclothemic disorder and unspecified. So, starting with bipolar 1 type. So, 1 is the type wherein there is an extreme erratic behavior of up period and low period. And up usually lasts for a week, and the which needs medical attention. When there's a up time or a high time, when somebody is experiencing a very high of their mood, which is very extreme in nature, can put the person in trouble and put others in danger as well. So that time the person needs to be under medical care. And when there's an extreme of down, that lasts for 2 years, 2 weeks. And here definitely the person need to be under observation but doesn't require much of attention, medical attention. But surely in this case of bipolar 1, a medical attention is required. And the type 2 of bipolar, here that is again with the erratic, highs and lows, but it is not as extreme as bipolar 1 type. So moving on to the another type, which is cyclothemic disorder. When we talk about cyclothemic disorder, this involves periods of maniac depressive behavior that last for 2 years in adults, 1 year in teens and children. So basically, in this is not as intense as the bipolar type 1 and type 2. So this is another type of bipolar. And talking about the unspecified one, which is unspecified, which can be through medication withdrawal, medication start, and there are a lot of number of reasons for this unspecified type. Right here, again, the person has only a few of the mood and energy symptoms. That is maniac or hypomaniac, right? So there are episodes of both wherein low and high things are there, the pattern of their behavior, their moods, either low, either high, and the symptoms may not last long enough. So it shows up for a while, and maybe then it gets settled down quickly. So this is what bipolar disorder, bipolar disorder, and here the types I have mentioned. Moving on to the symptoms of bipolar. When somebody is experiencing bipolar, so the symptoms when the person is showing or at very high or extreme of, or when there is a up period for them. So at that very time, the symptoms are excessive happiness, a person feel full of hopes and very excited, energized, and the person feel out of the world, right? And there's sudden changes from their joyful moments to feel terrible, angry, and get hostile. And the person show the symptom of restlessness. There's a rapid speech, because when the person at that point of time when experiencing bipolar disorder, and when they are at the highs, their speech is very rapid, and they just talk so fast, and there is a poor concentration, literally poor concentration, and the energy level is increased, and less need for sleep. They just don't feel like to sleep, and they don't find the need to sleep or to take rest because they are feeling so high. And unusually high sexual drive, and at that point of time when they are feeling high, so they feel high sexual drive as well. And the other symptoms at the high time is making grand and unrealistic plans. At that point of time, they just think so big, and plan so grand, and which is not even realistic. Sometimes they think of something which is unrealistic, but they think that this is going to really work out for them, but unfortunately it doesn't, and they feel more depressed. So there is showing poor judgment in when they are feeling high. They show poor judgment towards the things. Their judgment becomes really poor. They become abusive towards drug, alcohol, become more impulsive. They are less in need of sleep and less of appetite. 1 second, please. So moving on with the symptoms, which are when the person is at the up period. So there is a less of an appetite. The appetite is become very poor. There's larger sense of self confidence and well being. Being easily distracted is the another symptom of when the person is experiencing bipolar disorder. Moving on to the times when the person feels low, so that is sadness, low of energy, feeling of hopelessness, and literally the person keeps on thinking that he is worthy of nothing, he is incapable of doing things and not good enough. And the person has another symptom for not enjoying things that he or she used to enjoy or like in once upon a time in their life. There is a trouble concentrating in anything. They tend to forget things. They talk very slowly. There is a less of sex drive. There is an inability to feel pleasure. Also, there is an uncontrollable crying. When somebody is experiencing the lows, So at that point of time, they feel that, that they want to cry, cry, cry. Fine. And that is not into their control. They literally can't have a control in that. That is why there is an urge, they feel like to cry more and more. So another is, they find it very difficult to make their decisions. They remain irritable most of the time. They need more sleep, and they face problems of insomnia. Their appetite changes. Either they gain weight, either they lose weight, either they start feeding themselves so hard that they gain weight, or they just do not like to eat anything, and that's what make them to lose their weight. Also, there is a tendency of, thoughts of death and suicide at that point of time they experience, and they even try to attempt suicide. So you have to be watchful about the person or your loved ones who are experiencing bipolar disorder. So at that point of time, they can be very, very cruel with themselves, and they can attempt suicide as well. So it is a serious thing one needs to focus on. So moving on to the another type of depression, which is postpartum depression, also called as peripartum, or it is also stated as PPD. Fine. So postpartum depression is called as the sadness that happens after having or delivering a child. So basically what happened is that it happens during the hormonal shifts, right? And that affects the mood of a woman. And PDD depression can have its onset during the pregnancy, and it can end up or followed by the child's birth. And once the delivery is done, the basically the phase starts, which is called PPD, where the lady starts to feel really overwhelmed. There's a lot of depression and sadness in her life, and which is, as I mentioned, it is also called as peripartum depression. More than just the baby blues, right? It is one step ahead of that, and in this, there's a sudden mood change the women experience. She just experience a high level of anxiety, a lot of irritability, and that happens after giving the birth, and it often lasts up to 2 weeks. And when I'm talking about PPD, symptoms are more severe and long lasting. So it is basically a disorder related to women, and that does start from the stage of pregnancy until the woman has delivered the child. So when we talk about the PPD symptoms, so the major symptoms are trouble sleeping. There's a severe fatigue that she always feel, and there is a lower libido. There is a frequent mood changes that she experiences. There is a low mood also. Feeling of sadness remains with her throughout, and there is severe mood swings. Suddenly she thinks of something, and suddenly she becomes happy, sad, and all of the mixed emotions. And there is a social withdrawal. There is a trouble bonding with the baby as well. This is again a problem. And her appetite changes. There's a feeling of hopelessness, and there is a loss of interest in things that she used to enjoy previously, right? And there is a feeling of inadequate and worthlessness, as if she isn't good enough for anything. This is a sudden, blue phase wherein she starts to think like that. Maybe she is very good at confident, but at that point of time of her life, which is being, hovering on her, that is why she thinks or feels very worthless. And another thing is anxiety and panic attack, which is also constant during that time period. Thoughts of hurting herself, also hurting her baby. So that is one of the symptom. And there is a thought of suicide also, which is involved when somebody is experiencing PPD, right? That is postpartum depression. So one has to take care when somebody is going through, this stage. So their loved ones are supposed to be with them and be very supporting, so that the women can come out easily out of this depression. And in some serious cases, definitely a medical attention is required. Then she would need professional attention. Moving on to the another type, which is premenstrual dysphoric disorder. Again, this is a female disorder wherein, which is also called as premenstrual syndrome, which involves depression symptoms which are associated again with hormone changes in females that begins a week before and improves after the completion of women's periods. That cause a lot of irritability, lot of fatigue, lot of anxiety, lot of moodiness in a female, a feeling of bloating, increased in appetite. Also, there's a lot of food craving, and there are aches, and she also experienced breast tenderness. And this depression strikes women every month during her menstrual cycle. So it is related to the periods monthly cycle of women, right? And the symptoms which are associated with PMDD is extreme fatigue. She experienced a feeling of sadness, hopelessness, and she becomes very self-critical. There is a severe feeling of stress and anxiety. There's a lot of mood swings that she experiences, often with bouts of crying. She feels like to cry, and there's a lot of irritability she feels. And there is an inability for her to focus or concentrate on anything. It becomes a thing for her. She can't focus on anything when she's experiencing this kind of a depression. And there is a food craving or binging that she has to eat something, right? So these are the symptoms related to PMDD. Moving on to the next type, which is seasonal affective disorder, also called as SAD. When I'm talking about seasonal affective disorder, is a type of depression that relates, to changes in seasons. So it begins and ends, its onset and its offset is almost the same time every year. So when SAD is basically an extreme winter, depression, wherein the person experience depression symptoms, wherein the person becomes very sleepy, the weight is increased or gained, and that happens during the month of winter only. And when you see that person in spring or any other, season, that can be spring or summer, the person is perfectly fine, showing up no signs of depression. But since it does happen in people only in winters, and it shows up in winters, and this kind of a depression basically has remarked as, sometimes it to just few individuals it show up in any other season as well, but the pattern remains same. If somebody has started up with this depression, let's say in spring season, so it is going to affect that person in the same season, but usually it is a winter depression disorder, right? And it is also called as major depressive disorder, but with seasonal pattern. Here the depression starts in the person with the change of season, right? And especially when the winters are starting. Moving on to the types of SAD, which are oversleeping, definitely when it is a winter disorder, wherein depressive disorder, where the person wants to sleep a lot, their appetites completely changes, especially there's a more craving for food, high in carbohydrates. And when somebody is going to eat a lot of such food, of course, the weight will be gained. There will be a lot of tiredness. There will be low energy too. And the next type of depression, I allow my audience to really ask me questions and queries during the session only, and I will be going to answer all the queries at the end of the session, definitely. And until then, please stay tuned. All right, moving on to the atypical depression, that is a subcategory of major depressive or dysthymia disorder. So, when I'm talking about major depressive and dysthymia disorder, the person is strongly reactive to environmental circumstances and becomes too sensitive to rejections. The person cannot handle any kind of rejections when somebody is experiencing atypical depression. So this includes very sad mood, trouble in finding pleasure or happiness in anything or maybe the little things. Also, it can make people feel deeply sad. They remain so sad, their symptoms can automatically improve only when there is, a good situation being introduced or event has come into their life, which is positive enough, right? So hence atypical depression is more tied up to person's situation, also an environment. So this is very much related or linked with, if the person's environment and situation is good, the person is going to remain good. But if the circumstances are changed, the environment is changed, the situation is changed, this can really be a toll on person and can make the person feel depressive. So the symptoms can show up. So the symptoms of atypical are excessive eating or weight gain. Yeah. So in this atypical kind of depression, the person tend to eat a lot, and that's what will make them to gain their weight. There's an excessive sleep, right? The person will sleep a lot. There will be a lot of fatigue they will feel, and there will be weakness and feeling of weight down, as if they have no energy left in their body. And there will be intense sensitivity to rejection, as I mentioned. That is again another symptom when somebody can't accept any kind of criticism or rejections. So that simply is a sign of atypical depression. Also strongly reactive moods. So for sudden things, quickly when there is a change in mood, and the person becomes reactive, so which means a person is experiencing atypical. Also there's a feeling like their arms, their legs are so heavy, their body is actually very heavy, they can't take the load of it. So moving on to the next type, which is psychotic depression. Now, again, here it is again a serious form of depression, wherein psychotic depression refers to experience of losing touch with the reality, wherein the person isn't feeling or thinking straight, or is away from the, or deviated from the reality. The person, maybe thinking something else, or anything that is not real, can be hearing something, can be seeing something which is not real. So it is a major depressive disorder with certain psychotic features, and in it the individual suffer from combination of symptoms of depression, also of psychosis. When I'm talking of psychotic or psychosis, which means a mental state which is being characterized, either the person will be facing or experiencing delusions or hallucinations. Delusions where they have all the false beliefs which they start to believe is right for them, but which is not the reality. It is away from any reality, but that is what is their limiting belief, right? And hallucinations where they see or hear things that is not real, right? So sometimes in psychosis situation there is a combination of both also. So this is a serious type of mental disorder that need medical care too, and its symptoms are hallucinations, as I mentioned, when somebody sees or hear something that is not even present around, right? And then when the person have delusions, wherein there are a lot of false beliefs the person have, which is not the reality. They just start to believe something that is right for them, and they continue to believe that until that thing has been treated. And there's another symptom which is paranoid, where the person continuously feel or keep thinking that others are going to harm them. So when they keep thinking that this way, they remain very fearful, depressed, and their symptoms even can become very worst. So moving on to the next type, which is situational depression. So it is before I shall explain situational depression, I just wanted to mention that depression is a vast subject, right? It has many types, so it need to pay a lot of attention. Everyone who is experiencing depression need to understand the type of depression they are experiencing, have to have the clear understanding. They should know their symptoms clearly, and that is why in this disorder dialogue series I'm trying to portray and give you the detailed information which can help you. And if you're finding trouble, your emotional health concern is really hampering your day-to-day life, then you should know that you need any professional help. So never hesitate to seek help. This is for your good, because the symptoms which are showing up, if it is happening for a longer time, longer duration, then that is a serious affair. You need to pay attention. Never ignore your situation, right? Whether it is a physical health concern, whether it is a emotional health concern. So, all right, moving on with the situational depression. Hmm. So, when I'm talking about the situational depression, it is called as reactive depression. So in that, what happen is that it does happen when life really knocks you out, right? Or when life gets you down, and you are at a downfall of your life. Maybe there's a joke, there's something happened that has really knocked you out in life, and you suddenly start to feel so depressive, which doesn't remain in your control. And this definitely is a very short term depression, which is related to stress, also related to uh, trauma. So it can develop after the person has experienced either a traumatized situation or a very stressful situation. That can be events like when somebody has experienced with divorce, there is a retirement thing where the person doesn't know that he or she has given full life and work, right? And suddenly the person is getting retirement. What is going to work out next into their life? So that situation makes that situation actually toll upon a person in a very bad way, can show up with this kind of a depression, which is called situational. Also, the situation or event like when somebody loses their loved ones, there is a illness, serious illness when somebody get to know about, and in the relationship problems, and also where it stems from a person's struggle. If somebody has been experiencing struggle from a very long time, that's when definitely the person can get into depression. And this kind of a depression is called situational depression. And let's know about its symptoms. So the symptoms of symptoms of situational depression is feeling of persistent hopelessness and sadness. There is a constant worry in your mind that you're feeling hopeless, you're feeling completely sad, and there is a tearful feeling in your mind. You start to feel anxious, you become so irritable, you become very you feel that there's a lot of tiredness in your body. You tend to wait uh, tend to lose weight. Sometimes it is going to be increased as well. Your eating habits change so quickly. There are frequent headaches, there is a lot of interest in your hobbies, you feel low in self esteem, and you suddenly feel zero motivation in doing anything. Also, you find it very difficult to solve any problems. Your decision making skills really become very low, and there are changes in your menstrual cycle, in where that is in women, right? So if a woman is experiencing situational depression, definitely it is going to impact their menstrual cycles, monthly cycles as well. So there is a suicidal thoughts and desire of self harm in severe cases. So one has to be very, very careful. If somebody is experiencing this disorder also, you need to keep a watch on you. You need to keep a check and understand when you need help. So, moving on to the last but not the least, that is disruptive mood dysregulation disorder, which is also called as DMDD. So, when I'm talking about disruptive mood dysregulation disorder, it is a childhood condition. Here, the child either shows extreme irritability, extreme aggression, anger, or frequent tantrums that outburst in the child, and that is not in control of the person. That is beyond being moody. There are children who show a lot of moodiness in them, but when I'm talking about DMDD, here the child shows frequent, very, very extreme level of these, symptoms like irritation, anger. There's an outburst in things. The child doesn't behave really nicely. So children with DD experience severe impairment at that particular time when they are experiencing it, and that definitely requires clinical attention. So if you are facing any such thing with your child, it is a serious affair and you need to seek out help. And do not let this handle at only at home, because that can convert into a very serious medical problem. So DMDD symptoms typically begins before the age of 10 and definitely cannot be diagnosed before 6 and after 18 years of age. So this is an important information. And moving on to the symptoms of disruptive mood dysregulation disorder, which are angry outbursts. The child show a lot of anger. There is a period of rage in his or him. her, right? And there's a fits of aggression towards others, or maybe in the property. Person just shows a lot of aggression, aggressive behavior. Either they will destroy the property, they will try to harm the other person. There will be behavioral problems in school as well as at home, and among the peer groups, among the siblings. And the child will show a lot of verbal aggression, and there will be muscle tension in the child. There will be increase of heart rate definitely during the temper outburst, and there's an elevated or a raised or a very high blood pressure, inability to self regulate emotions. At that point of time, the child cannot regulate their emotions at all and cannot refocus on attention. When child is experiencing this thing, everything is out of control, right? He or she cannot control anything, even if somebody is trying to calming them down, right? And another symptom is extreme irritability, and the child shows a lot of anger. There is a fluctuation of mood that is very unpredictable. So these were the types of depression. I hope you are well versed with all types and also their symptoms. And I would like to mention that the symptoms of depression are quite serious, that need to be taken care, that need serious attention from an expert. And when somebody is experiencing certain things out of it, which are very normal, right? A little, maybe you can say aggression, or symptoms like when the person is feeling sad, or very low in energy, symptoms like that, if somebody is experiencing, is okay. But any symptom, my point is that any symptom that is really hampering your day to day life, or it is impacting your quality of life, then that is a thing that you need to put your attention on, right? Never leave any symptoms unattended, that need some focus, that need you to be aware of it. You need to accept what you're going through, and then there is a possibility that you can get the exact treatment. And definitely all the types of depression that I mentioned, everything is treatable. So this is a good news. So never lose your hope. If you are experiencing any such kind of a disorder, that definitely is going to be treatable, right? So now, with this note, um, so this is now over with the types, and I would like to share with you a case. So wherein I just, there are several symptoms, as I mentioned, that I'm not going to take up several like types here. I'm going to pick up just a quick case for you all, so that you can have a brief understanding of that disorder and the type particularly, and how you can take care about it. So this was the case 2 years back. I handled the female who approached me or reached out to me. She was 29 years of age, and she came through a referral, and that's when she approached me. She mentioned that she has just delivered a baby, and she was experiencing a very sad time of her life, wherein this was the phase she should be extremely happy, joyful. When you have a child in your hand, you feel differently. But there are people, or women, who go through a depressive stage, where that is not into their hands as well, definitely, but the circumstances and situations make them to feel that way. So she was experiencing postpartum depression at that point of time. She shared with me that she is not happy in her life since she has delivered the child. She is totally in a different zone. Her life has been changed upside down. Definitely there was a huge change that came into her life. Her life before was totally different. After having a baby was totally different. Now, to manage with this situation, she had to show up a lot of time towards the baby. She need to be more focused towards the child, to take care of her, because the child was too small, right? And when she was experiencing all of this, there were another problems that she was facing, which was that her life was definitely got impacted. Her relationship with the other family members, especially with the husband, was also very badly impacted. She didn't wanted all of this, but it was happening because of she was experiencing postpartum depression. So this was just for a certain phase, right? A person has to understand that what he or she, what she is experiencing. she realized that there is something happening and which is not really good enough, and she's not finding any joy. That's when she approached me, and with the intake of session, I realized that what she is experiencing. I immediately got done with the psychological assessment to know what is the intensity of her emotional health concern. It was on the severe level, imagine. And that's when I started with the intervention plan. I shared with her, and we started with the number of sessions. And with, I can say that number of 2 or 3 sessions, she was already getting a calm, and she was feeling extremely good. And with this she was getting better. And I counseled her husband as well. Both I called up for both of them to attend the session, so that they both should understand the responsibility, because before that they were just a couple, and here now, when there was addition in their life, when the child came, so now it was the time for both of them to understand that now they have to work as a team, so that they can live a joyful life. So both of them understood their responsibilities, and they were quite happy. And the that lady was very, very very sorted after certain sessions, and the therapy actually bring a great change in her life, and she became happy again. So this was one of the case of postpartum depression. There are a number of cases of depression with different types, but I just wanted to mention that everything is possible. When there is something which is hampering your day to day life, you should seek out for help. And this was the case. And now I would like to tell you that if somebody is being diagnosed with depression, what anyone or any therapist would be doing. So there is a foundational approach. If anyone is being diagnosed with depression or any emotional health concern, the very important thing is that the person has to focus on starting with the case intake, which is being followed by the counseling session, where there is a chance for the therapist to develop a rapport with the client, and wherein the client also develops a kind of faith, the trust, and where the client tend to start sharing things with the therapist. So there's become an open zone where the client feels very, very comfortable, and the session is totally confidential, which is being conveyed by the therapist to the client. And that's how it begins. And after that, when the psychological test is being done, the diagnosis is being made, and the confirmation is being made that what emotional health concern a person is experiencing. When the psychological diagnosis is being made, right afterwards, the treatment plan is given. So with the number of sessions, with the number of different therapeutic rounds, or say counseling rounds, the person shows a lot of decrease in their symptoms and becomes perfectly fine. So if somebody is being diagnosed with depression, if you ask me that how one I should go about it, I prefer using CBT, which is a cognitive behavioral therapy, that works beautifully, because the person at when the person is experiencing depression, that is very much related to the thought process of the person. So what you're thinking is going to impact on you the way you are going to feel. So how you're going to feel is going to impact on your actions, on your behavior. So it is the thing. When somebody is having depressive thought, you need to work on with the thought of the person. You need to change or convert the negative thoughts into the positive ones. That's one thing, right? And another therapy what we can use is that is DBT, right, which is very much related to CBT. So now when I'm talking about DBT, which is a dialectical behavioral therapy, in which is one step ahead of CBT. Why? Because here the therapist is supposed to teach the person, right? So the therapist teaches the person, awares the person with their wrong thought pattern, and helps them, teach them to regulate their emotions, and so that the outcome of their behavior can be rectified. Okay, so this is the another therapy that works wonderfully on the client. And other than that, the best is to, even when in the extreme level of cases, you can start with the EFT, that is emotional freedom technique. Here that is done with with the changes of energy level in the person. That is a tapping technique basically, but it works wonderfully, and it helps you to release all the depression or any other kind of emotional health concern. Also, it helps you to settle down all what you're experiencing. With the number of sessions, your symptoms are reduced, and this tapping therapy works wonderfully, shows great results as well, in which the energy of the disrupted energy in the body is being regulated and helped with the tapping sequence, and then the person feels relieved from their depression. This is the thing. And other than that, you can start with the art therapies, music therapies, dance therapies, because these are all the expressive form of therapies where the person, when feeling depressed, can feel really great, energized, feel some kind of a confidence in themselves, and feels some kind of a worth in them, right? So these and other therapies can also help. Also, the breathing technique, the meditation is also going to work out very well in the person when somebody is experiencing depression, because the person need to have a calm. They need to stop the thinking pattern which is continuously working at the back of their subconscious mind, which is not letting them to live happily. So that's what is very, very important. So not only these techniques, there are a number of other techniques as well which can be used. And as of now, I think these are the techniques that can very well used on people who are experiencing depression. And with this note, I am winding up the session and letting you know that these types and the symptoms, how you can deal with it and know your symptoms very well. And when it is serious, you have to understand to seek out for professional help. And how we do the psychological session, it's completely, there's a foundational approach which I mentioned. Hope that is going to give you more insight of how to treat somebody who is having depression. So I'll just have a look upon uh, to the chat box. Okay, so there is this one question: can depression and bipolar be clinically diagnosed together in a person? Yes, it can be, definitely. So yeah, and in just with this note, I want to say that there is a possibility of, if you're experiencing one kind of emotional health concern, there is a possibility that there is another type is also what you can experience. Also, with one emotional health concern, you can be experiencing other emotional health concern too. So that's what is my answer to your question. So hope it is. It hope you got your answer. And with this, let's end up the session because there are not much of the queries here. So now I'm ending up with the Disorder Dialogue Series 2022, which was on the disorder depression. I hope you have got a great insight, and I'm going to see you with my next DD4. The topic will be very soon displayed to you all, and hope this session has given you some good insight and can be beneficial to many of you. So, with this beautiful note, I would like to end up this session for today. And on the screen, I would like to leave my details just for a few seconds, wherein you can, if for any queries or if you want to take any more, services from Good Mental Health, you can definitely connect with me. You can check on my website, which is www.goodmentalhealth.in. Also, to connect with me for taking any appointments, you can check on my email ID, which is info@goodmentalhealth.in. I am available on LinkedIn, Facebook, Twitter, Instagram. In the YouTube, you can find my channel and with the name of Good Mental Health, wherein there are a lot of self-help tips already given. You can avail you can take the benefit of all of those videos which are already there, and subscribe to my channel for more getting the updates as soon as I post anything. And you can find my podcast station that is also again on the emotional health concern, that is with the name Good Mental Health Podcast Series by psychologist Anuradha. So at the end is my number given. You can connect with me for anything that you need help or advice for. So, with this beautiful note, I would like to take your leave. And until we meet next time, have very blissful days. So, take care, everyone.